Assalamu alaikum, respected teacher and my colleagues. How are you all? Hope you all are doing good. I am Ilyas Islam. Today, I and my team members are going to present you about the prevalence and incidence of tuberculosis in Pakistan. Before that, you know about the prevalence and incidence of tuberculosis in Pakistan. I want you to know about the tuberculosis. What is tuberculosis? Tuberculosis is an infectious bacteria disease characterized by growth of nodules in the tissue, especially in the lungs. Usually involves lungs but may affect other organs or tissue in body. It is the most prevalent communicable disease. It has two types. One is latent and second is active. What latent do? Latent tuberculosis is the tuberculosis that patient has tuberculosis as bacteria as disease in the body and he do not feel ill. And active tuberculosis is a tuberculosis that patient has disease that the patient of active TB spread disease by air, often from the air. The risk factor of tuberculosis, close contact situation. Close contact situation means if you are exposed to the patient that has tuberculosis. Second is alcohol and IV drug abuse. Certain disease, for example, diabetic mellitus, cancer, and HIV. Furthermore, my friend Anif will discuss about tuberculosis with you.
यस अनीस अनीस है ना?
Anif,
जी हनीफ आप हैं, अपने आप को अनम्यूट कर लें। हनीफ
ट्रिपोमाइसिन बैक्टीरिसाइडल और थर्ड जो है वो थायो सेटाजोन बैक्टेरी बैक्टीरियो स्टैटिक है। फोर्थ जो है पेराजिन पेराजिमाइड बैक्टीरिसाइडल है। इसके अलावा फाइव जो है वो एथामिबोल में एथम्बिटोल बैक्टीरियोस्टाइटस है। सर इसके अलावा जो नेक्स्ट स्लाइड है वो मिस यास्मीन प्रेजेंट करेगी आपके पास।
ओके मिस यास्मीन।
अस्सलाम वालेकुम सर।
वालेकुम सलाम।
Complication of TB: spinal 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 pain, back pain, and stiffness are common complication in tuberculosis. Joint damage, tuberculosis arthritis usually affect the hips and knees. Swelling of the membrane is cover our brain meningitis, liver and kidneys problem, and heart disorders. Incidence. Uh, New case of disease that occur during a specific period of time in population risk developing the disease. For example, there has 500 new cases of in inlands and population में 30,000 in a year. The mid incidence में जो है तकरीबन 16.7 per year जो है tuberculosis के cases जो है वो record होते हैं. Prevalence में number of affected person of population specific divided by the number of person in population of time. Two types हैं point prevalence and period prevalence. Point prevalence में जो है वो day, weeks और month का period आ जाता है और जो period prevalence में है वो month and years में आ जाता है। अब next नुमान continue करें please. नुमान
सर सद्दाम
सद्दाम जी कंटिन्यू करो।
स्किल नहीं आ रही।
ये आ जाती
सर रिलेशन ऑफ इंसिडेंट्स ऑफ प्रिवेंस ऑफ बैलेंस ये होता है सर, ये ट्यूबर जो स्मोकिंग हम करते हैं, जो ज़्यादा करते हैं उसकी वजह से ये बढ़ जाता है, उसकी वजह से ये ट्यूबरकुलोसिस बढ़ जाता है सर। नेक्स्ट सर, नेक्स्ट सर, ये डायरेक्ट ऑपिजन और थेरेपी शॉर्ट कोर्स जो होता है, ये ट्यूबर जो होता है वो उसकी माइक्रोसॉफ्ट ट्यूबर एक टेस्ट होती है सिर्फ। उसके अलावा ये ट्रीटमेंट जो हम करते हैं वो 6 महीने करते हैं, और रेगुलर सपोर्ट एंटी टीबी ड्रग्स लेते हैं, और सपोर्ट ऑफ अवेलेबल ट्रीटमेंट और आउटकमिंग होता है सर। नेक्स्ट the case of TB in Pakistan. TB highlight in Pakistan
Bacterium tuberculosis, poor hygienic and reduced immune status. What's the next?
जी
Sir, pulmonary transmission. It is an airborne disease, airborne droplet, cough or sneezing by the patient. Sign of symptoms: weight loss, fatigue, productive cough, fever, and night sweats. Hemoptysis, polyuria, polyuric pain, sir. Or manifestation signs के cough up of mucus and blood, excessive sweating at night. Diagnosis: physical examination, dullness of chest, percussion, increased vocal fermentasis. Laboratory test elevate the white cell count with lymphocyte predominance. Or third, cavitation show air fluid level as infection progresses. Tuberculous test positive, reduce reaction of intradermal injection of the tuberculin. Sir, next treatment. Desired outcome: initiation of specific anti-tuberculosis treatment, promoted resolution of the sinus symptom, achievement of a non-infection states, adherence of treatment regimen by the patient, cure patient as quickly as possible.
अच्छा ये तो उसने पढ़ ली है
ये हो गई हैं
Yes.
High risk group. Contact high risk group. The patient is a group, a person are at high risk that has contact with sputum positive TB cases, person with HIV infection, immigrant from countries with high prevalence, person in institutions such as prison or drug rehabilitation center, person with other risk factor, for example, diabetic mellitus, silicosis, prolonged uh, corticosteroids, and immunosuppressed therapies. Next lecture. Vaccine for tuberculosis has been being used from 1921 globally in all the world. BCG vaccine. Prevention for the tuberculosis. Take all of your medicines as they are prescribed until your doctor takes off them. Keep all doctor's appointment. Always cover your mouth with tissue when you cough or sneeze. सर ये आगे क्या लगा? Wash your hands after coughing or sneezing. Don't